My name's Erin. I'm a physiotherapist at Attuned Health Centres. I'm the director of our integrated maternity care team. The aim of the integrated maternity care team is to support women and their families through their journey, through the prenatal, pregnancy, postnatal, and beyond period. We use a collaborative approach and address each client as an individual. We assess their specific needs and, as required, coordinate appropriate services within the department. We develop a maternity care plan with the client, and then with the consent of the client, the plan can be accessed by all practitioners involved in the care of that person. We also work with the client's own GP, midwifery team, or obstetrician as well. So our team consists of myself, a physiotherapist with a special interest in women's health, an osteopath, dietitian, naturopath, psychologist, midwifery team, and our obstetrician. Common conditions that we might see or that people might call to come in to see one of us about would be musculoskeletal conditions like pelvic pain, low back pain. They may have some specific prolapse, incontinence, rectus abdominis separation. They may come in just looking for some exercise prescription. Some women will come in seeking dietetic advice, so they may have gestational diabetes or weight concerns. They may come in because they're experiencing morning sickness, fatigue, or reflux, or constipation. Other things like infertility, endometriosis, hormonal imbalances. In the postnatal period, it may be in relation to lactation issues or mastitis, or any feeding difficulties. There may also be, they may be experiencing stress, either pregnancy or postnatal depression, or just having a challenge adjusting to new parenthood. Some women will come in looking for massage, so whether it's prenatal massage or after having a bub. At the moment, we're not currently offering any lymphatic drainage or lymphatic massage. That's one thing we're not currently covering. So if someone rings up to book for an appointment, they can see any one of our team members if they have a specific issue in mind that they want treated. If they're ringing up just for a general assessment, then it would be best to book them in with either myself or Katie, our osteopath. They may be referred by their GP, or they may call up on their own, which is fine. So if it's a particular musculoskeletal issue, then they can be booked in with myself or Katie. If it's any specific women's health issue, pelvic floor dysfunction, prolapse, abdominal separation, or exercise prescription, then they should be booked in with me. If they're looking for psychological help, then they can see Gina. If it's any kind of nutritional or dietary advice, then they can see either Alison, our dietitian, or Helen, the naturopath. And then if for massage, they can see any one of our massage team, that's fine. So once the client's booked in to see one of us, we'll develop a plan with that client, and we'll decide whether any other practitioners should be involved with their care, discuss that with the client, and then we'll collaborate with the other practitioners to provide that service. And we'll continue to upgrade the maternity care plan as we see the client and discuss that amongst ourselves, so the client knows that we're all involved in looking after her and or the family.
So, Erin, how should people book in? How does the system work? Do they need a referral? Can they just come? How does that work?
No, so they don't need a referral. They can call Attune directly and book an appointment. Either if they have a specific request, then they can go ahead and book that through the reception. If they're not sure who to see initially, then they're best to be booked with either myself or Katie.
What does integration look like when it comes to the integrated maternity section?
Okay, for example, if a woman came in to see me and she had some low back pain, and so she was pregnant with low back pain, and she maybe had either was suffering a fair bit of morning sickness, plus she had, say, some pelvic floor dysfunction going on, then I would take note of all of that history. I would start off with treating her with some of her low back pain and pelvic floor dysfunction. Then I might make the suggestion that she sees our naturopath that can help with some of the morning sickness. She may or may not also benefit from seeing the osteopath as well. So we would discuss that, and if that's something she'd like to pursue, then I would help to arrange that appointment with whichever specific practitioner we were going to align her with. And then I would communicate with that practitioner, so I'd let them know that client was coming in. I've started a maternity care plan, so I've written clinical notes about that client, and that information has been passed on to the practitioner she's also going to see. Then we continue to communicate amongst ourselves in regards to how that person's going, or what's the next step with that person. So this cycle of care continues.
So if I'm pregnant, like when should I come in, and what are the benefits of coming to see somebody?
You can come in at any stage, but if you come in a little bit earlier, then we can start some of the preventative work that we do, particularly, for example, through physiotherapy. We might look at how that person's pelvic floor functions working in their core abdominals in the early stages, and making sure they're kind of optimized throughout pregnancy, and continue to reassess that as they progress through to the later stages.
And is it important to come in after I've had my baby as well? Is there programs and things that you would do to help there?
Yeah, so certainly, usually I'll review someone, depending on their type of birth. It could be as early as 2 or 3 weeks, or sometimes slightly later at 4 to 6 weeks if they've had a cesarean section. So we would evaluate their pelvic floor function, core abdominals. We'd look at any musculoskeletal complaints following delivery, and check how they're doing with their overall health, psychology, nutrition, covering all the spaces.
Can you tell me, how do we integrate the services, say, with the obstetrician?
So what we do is, if the client is already a client of the obstetrician, then she may refer that client over to one of us within our department for some specific therapy, and we would continue to communicate with her through our systems we have within Maternity. So using the same kind of clinical format, documentation, and care plans, so she's up to date with how we're progressing through our therapy as well. Or we may have a situation where we have a client that is just a client within the maternity team, and we may recognize that they have a need that would be best met by either our obstetrician or gynecologist, and then we can set up that referral for that person to see the obstetrician or gynecologist. Gynecologist has a standardized assessment that she uses that can be used to help identify specific needs for that client, and refer to dietetics or physiotherapy or any of the other therapies within our department. And we can also, within the process of her assessment, meet with any of our practitioners can be a part of that assessment, ongoing assessment with that client. Through our integrated maternity care team, we've seen a really amazing effect of how working together can really improve the care for the client and bring them along on their journey. And we're looking forward to joining our team and being a part of that team.